A pregnant woman presented in active labor and complained of her husband and relatives. Her history was that she had been pregnant twice and delivered these 2 pregnancies through cesarean section by a said medical doctor. She went back to the same hospital where she had antenatal, where she delivered her babies previously through cesarean section because she was in labor. But fortunately for her, the doctor was said to be out of town. Now, the history she gave us, or the story she told us, was that this doctor said for her 3rd pregnancy, he could permit her to try a VBAC. A VBAC, VBAC, is vaginal birth after cesarean section. That is a trial of labor. It means after a cesarean section, if the conditions are right, if the factors are favorable, a woman can be allowed to attempt a natural birth, a vaginal delivery. So I said, fortunately for her, because this doctor was out of town. Because how on earth in the 21st century will a medical doctor tell a woman who has had cesarean section twice that for subsequent pregnancies, she can deliver or she can attempt vaginal delivery? Well, to cut the long story short, my consultant counseled her and her husband for an emergency cesarean section. The husband agreed. She agreed. The husband signed consent for this emergency cesarean section. We swung into action immediately. We entered theater. Knife was on skin. And by the time we got to her pelvis, guess what? She had already ruptured her uterus. It was a silent one. It was not active at that point in time. But that part of the uterus where the surgical blade would usually pass through to bring out the baby had already opened up. That was the incision line of the previous cesarean section. All this woman needed to be unlucky was to have maybe another 1 hour thereabouts of active labor with very serious, strong contractions, and she will start bleeding. At that point in time, if she's lucky at all to go to any hospital that could offer her standard obstetric care, emergency cesarean section, the surgical team will start battling for her life. And this will mean that if she makes it, good. If the baby makes it, better for the family. If the baby does not make it, she will only be counseled. Because when we have uterine rupture, what we are most concerned about, who we are most concerned about, is the woman, is saving the life of the mother. Secondarily, that of the baby. Now, there are many risk factors for a woman to rupture her womb, to have uterine rupture, either in late pregnancy or in labor. If a woman has had a previous CS, she's at risk of uterine rupture. If she is a multipara or a grandmultiparity, by which I mean she has been pregnant to the point of delivery severally, I mean maybe she's carrying her 4th pregnancy, her 3rd pregnancy, her 5th pregnancy, the muscle of the womb, the uterine muscles are not as strong as before. They are weaker than what they used to be in her 1st or 2nd pregnancy. Then she is at risk of a uterine rupture. If this woman is carrying a set of twins or triplets, that's multiple gestation, the woman is at risk of uterine rupture. If the woman has had previous uterine surgeries, a myomectomy cutting through the whole thickness of the womb, for example, she's at risk of uterine rupture. Now, this is the deal. When you are pregnant, you need to go to the hospital that offers standard antenatal care. For delivery, you should not take chances. You should deliver in a hospital or in a center that offers standard obstetric care, by which I mean they can undo your childbirth process through natural delivery, and if there is a need for an emergency CS, or even during antenatal, if you are one that they see that you will need an elective cesarean section, they can offer you these services. If you are pregnant and you are attending antenatal, and for one reason or the other, you are not in the community, you are not in the city or town where you attended your antenatal clinics, you are in a new environment, one of the very first things you should do is to seek from colleagues, from neighbors, a good center in town, a good healthcare center in town that would offer standard obstetrics care for you. Because every day in sub-Saharan Africa, every day in Nigeria, the urban centers, the rural areas, we hear of maternal mortality. Maternal mortality is a woman dying from pregnancy and childbirth related conditions, related complications, sometimes even happening way after birth. We don't want this to continue to happen. Immediately you get pregnant, for you, for your husband as a pregnant woman, for the whole family, for the community, for your workplace, for organizations, for those of us in the healthcare space, what we want is that irrespective of the route of delivery, you and your baby should be alive and well. What we want is that irrespective of the symptoms or complications in pregnancy, we want your pregnancy journey to be an exciting one. If any doctor tells you, allegedly, doctor now tells you that after 2 cesarean sections, or any healthcare provider at all, because I've seen situations where pregnant women go to those that are not doctors, other colleagues in the healthcare space that are not doctors, to seek counsel for delivery, either in their first pregnancies, subsequent pregnancies, after natural birth, after cesarean sections, those who have complications in pregnancy, those without complications in pregnancy. Who you should go to should be your doctor, your family physician, maybe your midwife, who would refer you appropriately to a qualified medical doctor, a board-certified gynaecologist and obstetrician, a family physician. We want you and your baby to be alive and well at the end of pregnancy, irrespective of the route of delivery. My name is Dr. Fayomi Victor. I will see you in the next video. Cheers.